I am going to quickly launch the poll, and please let me know if you can see it. A thumbs up, a
Yeah.
yes, anything. Okay, thank you. The first question says, how well do you understand your body's anatomy and the importance? And that would be the importance of the parts. Very well. Good enough. I need some more education. I know just the basic stuff. So there's that. That's number one question. Number two question says, do you believe men and women experience symptoms for certain health conditions differently? So if I have a headache, am I experiencing the headache the same way as a man will experience it? Keeping all things equal, all things basic. Yes, significantly, somewhat, not really, I'm not sure. And then the next question is, which area of health do you think shows the biggest difference in male and female experiences? Is it the mental health? Is it heart health, stress and burnout, pain management, reproductive health? Number four, which gender, and passes as gender or sex here, which gender do you think experiences greater pressure to appear healthy even when struggling with physical or emotional concerns? I'll read that again. Which gender do you think experiences greater pressure to appear healthy even when struggling physically or emotionally? Men, women, both equally? I don't know. And our last question says, at what stage do you think most people tend to take health seriously? Preventive, that is before the problem arises, after noticing recurring symptoms, after a major health scare, or per the suggestion of others. I'm going to run over the questions one more time very quickly. How well do you understand your body's anatomy and the importance of the parts? Very well. Good enough. Need some more education, just the basic stuff. Second question, do you believe men and women experience symptoms for certain health conditions differently? Yes, significantly. Somewhat. Not really. I'm not sure. The third question says, which area of health do you think shows the biggest difference in male and female experiences? Mental health, heart health, stress and burnout, pain management, reproductive health. Number four, which gender do you think experiences greater pressure to appear healthy even when struggling physically or emotionally? Men, women, both equally? I don't know. And the last question, at what stage do you think most people tend to take their health seriously? Preventively, that's before the problem arises, after noticing recurring symptoms, after a major health scare, or per the suggestion of others. Thank you so much. We are at 80% participation. That is good. I am going to end the poll and then I will share the results. I believe you can see my screen, and this is what we have. So 67 of us believe that we know our body's anatomy very well. So that is very good. And one out of those that responded needs more education, and one knows just the basic stuff. And two people have good enough knowledge. And for this next question about how men and women vary in their health experiences, we say yes. So 91% said yes, very, very significant experiences with certain conditions. And then the next question is which shows the biggest difference in health experiences for male and female. The highest is 36%. 36% said reproductive health, and 27 said mental health. And then we have others for various responses. And number four, which gender do you think experiences greater pressure to appear healthy? And 55% says women. And of course, the next runner-up is men. And the last question is, at what stage do you think people tend to take their health seriously? And 82% says after a major health scare. That's an interesting response to receive from all these questions. Thank you so much for participating. It is time for us to start our discussion. And the very first question I have, and I'll be directing this to my first female panelist, and this is going to you, Dr. Simone. And the question that we're going to start with, aside sex and reproductive organs, what major anatomical difference can be seen in male and females?
Good evening, everyone. Good afternoon. It's good to be here. Thank you, Kim, for the invitation. The brain is different. Women and men, we have brain. We have the left hemisphere and the right hemisphere. The woman brain, both hemispheres communicate a lot more than the men. They have done studies over the years, and they realize that there is a huge difference. The men tend to be localized, whereas the woman is more universal. It seems that the fiber crosses faster and more in the women than in men. So, and also they found that although the men's brain is bigger, but our brain, I'm going to say, function better. No offense to the guy. Our brain because
None taken.
our brain functions better. So women are more sensitive. We tend to be more intuitive, whereas men are more analytical. So our brain, although women do have also a lot of analysis in their brain, we can do a lot of analysis as well, but it's tempered with emotions.
Thank you, ma'am. Dr. Carlos, you were quick to offer your accommodation. What's your response to that, and how would you also answer the question?
Yeah, I would totally agree with that. I think there are maybe a few more things we could touch on. You know, the skin of men versus women, the hair and the way it's distributed differently, and then just the physical strength and physical power. So of course I'm answering from a male point of view, right? Because all of these things have evolutionary significance. The way the more supple, less tough nature of women's skin, the thickness of men's skin, the way the hair is distributed, heft in general. Men are more likely just to be bigger and to have more physical power, because this is what we have evolutionarily been made for, versus endurance. Women are really built for endurance, and also I'll go back to Dr. Simone, for emotional power versus physical power. And there's a role for both in terms of having good health. There is it's been studied, and a recognized difference between premature babies in the NICU, and which ones are likely to survive and which ones are least likely to survive. And the ones who are most likely to survive are the little black girls, followed by the little black boys, followed by the little white girls, and in last place, little white boys. And all of this represents, some difference in how boys and girls are made physically and hormonally and emotionally, and what we're all built for. Yeah, so that would be my answer.
Thank you very much. Thank you. It's interesting that there are a number of things that did not even cross my mind. I knew some things, and I'm listening to you talk. I'm like, that's interesting that those things would, for instance, the skin. You would think the skin is basic for both sexes, but that's an interesting one for me to pick on. The next question I have is, so now let's talk about hormonal differences. How exactly does this present in males and females in terms of our health experiences? Dr. Carlos, would you start, please?
Yeah. So I just sort of jotted down some observations about hormonal differences as it relates to insulin, cortisol, growth hormone, prolactin, the stress hormones, epinephrine and norepinephrine. I don't really recognize that there's any major difference between men and women. All of these sort of help us helps the body regulate itself metabolically speaking. Um, and help to help us manage weight and sort of how we process sugar, how we respond to physical and emotional stress, how we weather illness when sickness comes upon us. So those basic hormones that that are shared across gender, um, they're going to perform the same. But the difference comes when we start talking about sex hormones, testosterone versus estrogen, and the balance of testosterone and estrogen as we age. So testosterone levels for men begin to drop off. Really, they start dropping off as early as in our 30s, but men can start to feel the drop off in our 40s, and that's why by the time men are past maybe 75 years old, the features of men become more feminized. And it's due to the dropping off of testosterone levels, which with natural aging. So, that sharp, square jaw that you had, that physical muscularity that you had as you get older, those things, the face and the physical uh, body just starts to look a little different and a little bit more feminine as men get older. And the same is true with women. As estrogen levels start to drop off, then women actually become more masculinized. They become more hirsute. They'll start to get, a mustache and beard and chest hair and things that they didn't want, and they will experience really male pattern balding, and it's because the balance now of testosterone and estrogen are shifting. With estrogen dropping off, this is why we start to see, as you mentioned early, Kimmy, women after a certain age begin to have cardiovascular events because they are now losing the cardioprotective benefits of estrogen. So once you start losing estrogen, what you see is an increase in free radicals. And once you get an increase in free radicals, you see more systemic inflammation, you see reduced blood flow, you see cholesterol start to climb, and then from all these things, an increase in cardiovascular events. And testosterone doing almost the opposite thing. With testosterone, we see increasing in hemoglobin, therefore decreasing flow and increasing cardiovascular events. We see increasing cholesterol. Um, um, these are the things that testosterone does. Increases the cholesterol, increases the blood pressure, makes the prostate grow faster, increases hemoglobin, and so uh, the sort of balance of men having all of the cardiovascular events at younger ages, women catch up as our testosterone levels start to drop off and your estrogen levels start to drop off.
That was so well laid out. I was smiling at some point. I was going to say, that explains why some men begin to look he said female-like. And I was going to ask you, are you sure it's a 75? It could be earlier than 75. And then you had to go around the back to hit the woman with the lowering of estrogen levels. So that was interesting. And I had a question actually about the cardiovascular disease for women, and you answered that question with saying we lose the protection that estrogen offers us as ladies. So thank you for bringing that up, because that was a question that I personally had in mind. So thank you.
I'd like to add that women have more thyroid issues than men. And they think it is because of estrogen and progesterone in women. And the literature had shown that many certain illnesses are more prominent in women than in men, again, because of the estrogen and the progesterone, whereas men are protected. Like you have Hashimoto thyroid disease, for example, you have more women with that condition than men, again, because of the estrogen. So we see that there's a pattern, even diabetes. They think that the men is protected because more women have diabetes, something that is as simple, whereas they feel that more men has hypertension than women. Again, it has to do with this. We sometimes don't understand the relationship with the sex hormone and the other hormones of the body. The Lord had made us wonderfully and marvelously made. And because of it, everything, there's nothing that is separate. Everything is intertwined. Your psyche, your mental health, your physical health, your emotions, all is one combined whole. So sometimes we try to tease out things, but if we put it all together, we realize we are all, everything in the body is connected. Everything is connected to the brain. Everything is connected to all your hormone. It's connected to your heart. And yes, although we have differences between men and women, we're still one body. And the more we understand that physiologically, mentally, and spiritually we're one, the more we understand that, the more we can help our health, the more we can change things in our environment, in the way we perceive things, the way we eat, the way we exercise, what we do for us to have better health. Yes, we have differences, but it doesn't have to be this way. We don't have to say, well, because I'm a woman, I'm going to have thyroid disease. No, that's not the case. You don't have to be defeatist in what you think about yourself, because when you think negatively, it's going to affect you. It's going to affect your health. So you need to think positive and take action to prevent things from happening.
Thank you so much, Dr. Simone.
Can I just mention that sort of brings us, and you may have a question about it later, so I'm not going to go too far with it, but that just makes me think about, how we have, in the physician community had sort of stopped all hormone replacement because of breast cancer risk and things like that, without considering all of the other benefits and effects of estrogen replacement, for example, as women's estrogen levels begin to drop off, and how now we're sort of coming back to the middle on that, because we're recognizing sort of, it's not all or nothing. It's not one or the other. To echo Dr. Simone, it's a little of this and a little of that, right? That sort of keeps us generally healthy and somewhere toward the middle. So we start to rethink about all of the cardiovascular benefits of small doses of estrogen replacement for the appropriate woman, and small doses of testosterone replacement for the appropriate man, because of all of the other benefits. So on balance, with taking into consideration, the risk of certain hormone-related cancers, with the benefits, though, of cardioprotection for heart attacks and strokes. My wife, I know she wouldn't mind if I mentioned this. This is why I feel comfortable doing it. But we had we're both 57 years old now, and sex was extremely painful for her. She couldn't sleep at night. She was dealing with depression. Um, um, and she all her arthritis was worse, all these things. And then and her mother had a non-hormone related breast cancer, a non-estrogen driven breast cancer. And so she was very reluctant to do any kind of estrogen replacement for that reason, even though she genetically tested where she's not at risk, at any increased risk based on her mother's history of breast cancer. Eventually, she just got miserable enough with hair thinning, dry skin, dry vagina, emotional lability, not being able to sleep, hot flashes, that she said, this couldn't be good for me. There's no telling what I'm doing to my cardiovascular health, just letting these symptoms just sort of go on, because all of these symptoms are indications of chronic and systemic inflammation. That's what they are. That's what they're telling you. And she just went on a low dose estrogen patch. She doesn't have a uterus. Okay. So she went on a low dose estrogen and all of these symptoms went away. So there's a role for us to sort of come back to the middle when we start thinking about hormone replacement in men and women as we age, and not have the baby and bathwater approach to hormone.
I would like to add to that, since you brought this up. They have done studies over the years. For example, they have done studies in China where they realized that people in China, they don't eat like the people in the West. They eat a lot of plants, plant-based.
Yeah.
When they have maybe something of animals, just like a tiny bit of chicken or a tiny bit of beef, but mostly they eat plant-based. And in China, women don't have all these hot flashes and vaginal dryness, whatever else you want to call it for women over there. They don't even have a word for hot flashes until they came to the United States. Once they start eating like we eat, they have all the symptoms that we have. So if you see the way they eat and the way we eat, you can tell the difference. When you eat an anti-inflammatory diet, whole food, plant-based diet, certain symptoms you may
You
not
don't get
have.
them.
You
Yeah.
don't get them.
Yeah.
Even you simply replace your normal estrogen with phytoestrogen, which is plant estrogen, you don't have hot flashes. You don't have all these things. It goes back to combat the inflammation.
Yes.
Food is your best medicine.
Amen. Amen, Doc.
Thank you. Yes, amen, Dr. Simone. Thank you so much, Dr. Simone and Dr. Carlos, for just we're just scratching the surface, and we have enough to run with already. Even if we're to call it a day here, I believe everybody would agree that you've probably learned something that except you're, deep in the medical field, but for the rest of us, we probably learned one or two things that we did not know about before. So thank you. I did mention we have another panelist in the room, and this is going to you, Dr. Bumi. And the question is, so what are major health symptoms that are commonly overlooked and misdiagnosed when they appear, across sexes? So like we had in the poll about women dying more from cardiovascular issues because most times it's misdiagnosed or the treatment is delayed. Would you please touch on that and cite a few more examples?
Thank you to Drs. Simon and Dr. Kaius. Sorry, I've been quiet all the while. It's just been a very interesting conversation between you both. Okay, so you did mention that there can be some symptoms that differ between both genders, and which is true. There are some conditions that tend to be more common in some genders than the other. And like it's been mentioned before, cardiovascular events, heart attack and the likes of it, tend to occur more in men, and then increases, the risk of it increases in women, once they cross over to the menopausal age. It can occur before, but it increases once they cross over to the menopausal age. And so when a young woman is presenting with or is complaining of symptoms, that could really be a heart attack or cardiovascular event, we may not take them as serious, or they may not present as in the typical way. Sometimes they could just present with symptoms like indigestion, they're having some burning or some central pain, somewhere in the chest, and we're like, oh, probably it's your stomach or something, or they're complaining of so much fatigue and the likes, and you're very stressed, you've been having, probably there's some tension at home, or probably some emotional, problems, or complaining of nausea and things like that, and we may not necessarily pinpoint it particularly to be a kind of cardiovascular event, but this is one way in which we can miss things if it's not, just because based on the gender and probably the age as well. So it is left for the clinician to, have a broader mindset and to know that when the woman presents with this, we should have this at the back of your mind as well. And that's just talking about the cardiovascular or heart attack condition, something like that. And also, when we talk about mental health, generally, females are the ones that present with, depression and anxiety and the likes of it. And, we tend to see it as a woman problem. They are always stressed, they're always depressed, and, they have so many emotional baggage to carry about. And we tend to make men feel like they should be strong enough to cope with whatever hardships or mental stress they have. And so men tend to not present like the typical way you expect somebody to present with, for instance, depression. Without depression, we probably just begin to get withdrawn, or personality change. You begin to get angry, or you begin to go to, alcohol or substance misuse and things like that, begin to have problems at work, or at home, and not the typical presentation you would ordinarily, expect. Like a woman will come and tell you, I'm low in mood, I'm not sleeping well, I'm not eating well, and my those are the presentations you probably expect to someone that has depression. But a man may not necessarily come and say all of those, but tell you I am sad. They would want to man up in quotes. And all of this would, you need to dig deep. You need to dig deep and start, probably picking on different aspects of life to be able to, hit the nail on the head and understand that, okay, this man is probably depressed. So that's another way in which, symptoms can occur, but do not look like the typical way, we find this in both genders. And I think I'll just talk about osteoporosis. Osteoporosis is more like weak bones, okay, and tend to cause fractures, in people generally, and you find that in older adults mainly, okay, because normally, as one grows older, the bone density reduces, and then we get to have tendency for broken bones, little fall, and they break their bones and things like that. And so, when the woman becomes menopausal, just like we talked a lot about estrogen, estrogen comes to play here as well. And because there's a drop in the estrogen level, you lose about up to 20% of the bone density mass. And so they get to have osteoporosis easily, and then they can have fractures easily. And so people get to think of osteoporosis more with older women and forget that a man can also have it, because we've already mentioned that they get to have higher bone density and they get to have higher muscle mass and things like that. And so they're usually stronger physically. But we get to forget that men can also present with symptoms symptoms of osteoporosis and can also suffer from diseases. These diseases. So I think this is just a little of some of the ways in which we can present with things and may not be based on the agenda and may distract us from what is really happening. So there are quite a number of it really. We can go to town on it, but things like cardiovascular events, mental health stresses or mental health presentations, we tend to tilt it towards one gender than the other, and so we get to miss the way they present in the other.
Thank you so much, Dr. Something funny, and I'm glad the Lord reminded me to say this, because I remember when I was in high school, not just me, but the girls too, but I'll speak for myself. When I was in high school, I hated saying I had tummy trouble, because as a girl, you say you have tummy trouble and everybody thinks it's a menstrual issue. And there could have been other reasons for having tummy trouble. So, you don't want to say you're cramping. We were not as confident to say menstrual issues because, back then everybody was just a little touchy about it. But yes, even though that might be petty, I see how it could have built into a system where some things are, we kind of have like a stereotypical approach to dealing with them without necessarily taking the time to go deeper to understand what exactly is the root cause and how to administer the right care. Thank you so much for touching on those. I am sure Dr. Carlos and Dr. Simon, you probably have a response to this, but we have a question in the chat box, and I think we should, we have a comment and we have a question. And the comment says, it really depends on the person. And this is going to, I think this is addressing nutrition of diet. And it says it really depends on the person, because I know some ladies that are vegan more than 20 years of their lives and they still have hot flashes and other symptoms. I would reckon that there will be exceptions since bodies are different, but we might as well agree also that on a larger scale, a diet that's reduces inflammation will probably also help to reduce the symptoms that are associated with inflammation. And the question we have here is, what is the best natural or plant-based hormone or estrogen replacement for women? Who's going to get this for us?
Let me talk about the vegan. Some people are vegan, but they don't have a balanced diet. Because when you consider the gut axis, brain axis line, it takes more. Somebody may eat broccoli, cauliflowers, cabbage, but they miss the pomegranate and the kiwis and the blueberries. You have I don't know, over billions of microbe in your system, and your microbiome is very diversified. So if you eat only one type of food all the time, some of this microbiome you're going to have a lack. The balance will not be there. So just to say the person is vegan, you need to see what they're eating, how they're eating, and some people are vegan, they eat a lot of sugar, and sugar causes inflammation. So if you eat sugar that is going to cause inflammation, although you eat cabbage, it's not going to balance it out. So you need to see what the person is eating. When it comes to the estrogen part, you have phytoestrogen. You find phytoestrogen in plant leaves, lots of green leafy vegetables, okay? You have collard green, mustard green, what do you call that? Spinach, kale, all these things have phytoestrogen in it. And also you have soy milk, edamame. Those are very rich in phytoestrogen. For somebody to In fact, I had my patients who were having hot flashes, and they were very reluctant in taking hormone. I just told them what to do. They eat lots of greens. They had soy milk. It went away.
Yep. Soy is a big one.
Soy is a big one.
Yeah.
And soy is also good for men. Men tend to avoid soy, but soy is also good for men. When you have a low estrogen, because men also has estrogen, because
Yeah.
when you go to your andropause phase, you need estrogen.
Yes. Tell me about it. I'm in it.
You need estrogen. So, and you have many leaves. I know. I love natural medicine.
Me
I
too.
love that because the Lord put plants in nature. For us, it's a pharmacy. There are lots of plants that that we can use to help without going to the pharmacy.
Thank you. For a second there, it felt like you were having you left some of us out of the conversation. You were having doctor chats, but we forgive you. We bring ourselves back into the conversation. A question that, it would be nice for us to touch on even following this now comes to screenings, because before we go to screenings, we already established that symptoms can present in people in different ways. But I still want us to go down to how we actually experience them. So basic question, when I have a headache and, all things being equal, I have a background in economics too, and my professors then used to say ceteris paribus, everything being equal. So let's assume there are no conditions for different, there are no variables that are differing amongst, us. But if everything were the same, and I have a headache, am I going to be experiencing the headache the same way my husband? Is he going to have the same experience to a headache? Or let's go to something deeper, say a heart problem. Would I experience it the same way he would experience it? God forbid we have something like that. Would someone please take this? Dr. Carlos, would you take it?
Yeah, the answer is just no. You don't experience it the same way, and you don't respond to it the same way, and you don't survive it the same way. So, yeah, the answer is just no. It's one word.
You have to know that women tolerate pains better than men.
Yes, it's true.
If men were to give birth, there'll be nobody on this earth because
Great.
they do
I
not
can agree with
tolerate
that.
pain.
Yeah.
We women can tolerate. I'm going to speak for myself. I can tolerate a lot of pain. In fact, I had knee replacement. They gave me hydrocodone to take. Do you know, when I came home, I was in pain. I was in pain. If I tell you I was in pain, I was in pain because I can tolerate pain very well. But I didn't take the medication because I know when I take that medication, I'm going to be la 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 and I won't be able to think. I cannot sit. It's not good for me. So what I did, I prayed. I said, Lord, please remove the pain from me. Do you know the next thing I know, it was the next morning. I didn't even know when I fell asleep. And from that day, the Lord removed the pain. I met somebody who also had knee surgery. She took all the 40, they gave me 40 tablets. Usually I don't take medication. She took all 40 tablets and asked for another prescription.
That would be me.
Yeah.
Give me the drugs, child. Give them to me, please.
I have a friend of mine, when he is in pain, oh, please, he's like a baby. Oh, he has a pain. Oh, give him his medication. Prescribe for him. It just, I'm telling you, if men were to give birth, there'd be nobody in this earth because they cannot tolerate pain. They are very strong and feel they can handle everything. When it comes
But
to
not
pain,
pain.
they are not
Amen.
pain.
Yeah, no,
And not emotional pain either.
no.
Because
That's
as
right.
Dr. I forgot her name, just mentioned, mentally, women are stronger.
Yeah.
I guess because of the corpus callosum crossing on both hemisphere, when we are depressed, when we are sad, we explain it, we can express it, whereas men feel it's demeaning for them to express that they are sad. To them, they should be able to handle it because they are strong and they are the stronger sex. They should be able to handle it. They don't, and that's why so many times they get to the point that they are so far down, it is very hard to bring them back up because they cover it up because they cannot explain and they don't accept that they have, I'm going to say, weaknesses.
Yeah.
That's the problem with men.
And that shows up in us differently. It shows up as aggression,
Right.
as apathy, like complete
Withdraw.
disconnection, complete and total disconnection from everything and everybody. And yeah, because we do have a very unhealthy way as men of dealing with pain, particularly emotional pain.
Dr.
Yeah.
Carlos, I have a tricky question for you. Would this then be the explanation for there being higher citations of midlife crisis in men?
Yes. Again, it's one answer. Yes.
Thank you for being very truthful. Thank you. Thank you so much. Okay. I can
Or
say-
adolescent crisis for that matter.
Oh,
More prominent in young men than in young women.
okay.
The same reason.
Thank you for laying that out. It didn't cross my mind, but that's why you're the doctor. So thank you for bringing that up. Okay, so now let's talk about screenings. And Dr. Bumi, would you take screenings up? What are screenings that are important per sex and at what stages? If we could quickly go over this.
Okay, there are quite a number of them really, and depends on which, where you find yourself in a part of the world and the kind of screening programs that are, available for you. But I'm just going to touch on some of them. And I think in one of the sessions we had recently, we did talk about screenings and what is recommended, but it's a good thing for us to have a revision of that again today. And so I'm going to talk about female first. The females, usually we talk about cervical screening. Okay, and so of course you cannot expect to do cervical screening in a man, so it's just for the females. So that is specific to them, and it started from the young from when they become sexually active. Okay, and that's recommended, and breast screening as well. The breast screening is usually recommended, as they go over 30 years, they go 40 years and above. And the yearly or the pattern to which, or frequency rather, to which it is done differs, whatever location you find yourself. But it's very important for this to be done as well. And I'll go to men and then I'll come back to talk about some that should be done altogether, okay, in both genders. And for the men, usually we do prostate screening, and that can be done after the age of 45, 50 years. It's expected that you can start having your prostate check done as well, and that can usually be a blood test. For the cervical one, is a smear where a sample is taken just to be sure from the private area, just to check things and see to be sure there are no changes. For the breast is usually a mammogram that's done, and for younger women we do an ultrasound. And for the prostate screening is usually a blood test, and depending on what's found, we go ahead to do other tests. We also do screenings for bowel cancer, and that is usually open to everybody. I mean, both genders, and we usually want to do it from middle age and above, because you expect that it should not be found in younger age groups. But unfortunately, these days we're beginning to find lots of young people with bowel cancer. So once we get to have any inkling of symptoms in that wise, irrespective of the age group, we want to do that. We want to check for that as well. Generally, well, we do blood pressure monitoring, but that's for everybody as well. And everybody should check their blood pressure, male or female, but you want to probably make sure you're checking it once you start getting to maybe the age of the middle age and above, because you have a higher risk to have cardiovascular problems or hypertension. And for women, again, by the time we get into the menopausal age range, that needs to be definitely checked. Same thing with diabetes as well. Diabetes screening, we check the sugar, and also there are lots of things that can be done really. But just to be specific about the gender, more it has to do more with the reproductive organs for person is part of it as well. And every other thing really boils down to everybody generally. Just depends on the age group and where they're falling.
Thank you so much. Before anybody responds, I do have something to share. So when we're working on the slides, I had a question about taste. And something that came up was that men tend to crave spicy and savory foods, while ladies tend to crave more sweet things. And in fact, they brought it also down to say considering sweet things, some men would take sweet things, but they won't take chocolates. And that was an interesting thing for me to find. Now, I don't know how true that is, because a lot of things fly out on the net. It was in a peer-reviewed article, so I will want to assume that is correct. But if somebody would tie that into this next question that I have about lifestyle. So what are some lifestyle practices that are associated with males and females that could impact the health experiences that we have? We know some things cut across, but there must be some things that men tend to do more of and ladies tend to do more of that could, that could impact the health experiences that we have. Dr. Simone, would you take that, please?
Sure. Lifestyle. It has a lot to do with your upbringing, what you like. If I grow up, for example, I grew up in the Caribbean. My things are mangoes, avocados, sour soap, and all these tropical fruit, number one in my list, right? But if you take somebody who grew up here, they will have mostly apples, oranges, and peaches, and things like that. They are both good. But I have to develop a taste for these fruits because, again, I didn't grow up with them. So when it comes to lifestyle, you have to take into consideration what people will eat and what they will not eat. Because you see, God didn't make one fruit only to do one thing. So just like, for example, I may like blueberries. It has a lot of anthocyanin in it. Somebody may not like blueberries, they like blackberries. They have also anthocyanin in it. Or you don't like either one, the Lord made purple potato or purple sweet potato. You still have the anthocyanin in a different form. So the taste of it, like I like sweet, I love chocolate. I do, although it may not be good for me, but I love chocolate. But for me to use chocolate, it will have to be dark chocolate, not the milk chocolate that is mostly milk and sugar. When you really want to have the real effect of the chocolate, it has to be dark chocolate. I may put that in my drink and have my chocolate or even bake a cake with it. I love sweet, like I said, I'm a baker. So when you take somebody, for example, a man may like sweet. Some people may like savory. So you have to depend on their upbringing, their taste buds, what they develop, because when you take somebody who never ate plant-based, to them it's bland. He has no taste. You don't want, so you as the chef, you need to know what spices you're going to put into that food in order to enhance the flavor of the food so that person can enjoy eating it. So it's not so much that men like sweet and doesn't like sweet. Again, it's just a matter of preference and also how the food is prepared. If the food is, I've eaten food, they are bland. But if you put like onion and garlic and lemon juice, you flavor it, you put some, of course, you put hot pepper. I'm from the Caribbean. I'm going to have the hot pepper.
Amen.
Okay. So when you put all this, it flavors the food. Even somebody who is not a plant-based person, that person will enjoy the food. And remember, plant-based, Hippocrates said, make food your medicine. Your food must be your medicine. So you need to have a variety of flavors, a variety of colors, a variety of different food. When you have your plate, it should be, they said, a rainbow color. You have all red and purple and blue. You have all these colors because all of them, the yellow one give you beta carotene, the purple one give you anthocyanin. They all combine together to get rid of free radicals, decrease inflammation, and for you to have better health.
Mm-hmm. Thank you, ma'am, for laying that out. And yes, I do know that you have a sweet tooth. In fact, you're a wonderful baker too, because I have seen your cake. So thank you. Thank you for putting yourself out there for us. Dr. Carlos, I would come to you on this, and something I would love for you, because we are, managing our time, to touch on would also be, I love that, Dr. Simone, you talked about upbringing. So as parents, as grandparents and community people looking out for each other, we have children, we have young ones coming up. We need to start helping them to make better health decisions and be better health informed. So what are things that we need to bear in mind and bring up in conversation when we talk with younger people, about their health, especially even while they are different in sexes? So you can touch on lifestyle and upbringing, all together. Very succinctly, please. Thank you.
Yeah, I just try to teach my girls, who are adults themselves. One is 27 and one is 31. But from the time they were little girls, even until now, I just sent them a text this morning about just how to just do better in terms of caring for their health. And it's really just the basics. It's like 4 or 5 basic things that I harp on, not just with my family, but with my patients also, which is prioritize rest. People don't, I don't think people understand how important sleep is and how all good things to your body happen during sleep. Healing happens, hormonal regulation happens. All of these things happen. Memory consolidation, all of it happens during rest, during sleep. So prioritizing sleep, exercising regularly. So don't be a weekend warrior. Some people don't do anything all week long, and then on the weekend they try to make up for what they have not done all week long. And that doesn't work. Actually, that actually increases your risk of having injuries, increases your risk of having cardiovascular events. But your your exercise life has to be really about the drip drop. It's the little drip sort of all week long that makes the difference in your overall health, and you can't cram it all in on the weekend. So I always recommend regular exercise about every other day. So about 150 to 200 minutes a week of exercise, mixed cardiovascular and strength training. So for me personally, I do 4 50-minute sessions a week. I work out Tuesday, Thursday, Saturday, Sunday. Tuesday, Thursday, Saturday, Sunday. I found I can get about 200 minutes a week if I do it that way. So sleep, exercise, don't smoke. Whatever you do, don't smoke, and then eat the best food that you can afford. So those 4 things, in addition to caring about your mind and your spiritual health, finding time to just be quiet and let your mind rest while you're awake through things like prayer and meditation and yoga. So I found if you just keep the basics, those four things: eat the best food you can afford, um, prioritize sleep, exercise regularly, and don't smoke. And then pay attention to when your mind is awake, trying to keep yourself in a peaceful place through things like prayer and meditation.
Thank you, Dr. Carlos. That makes a very wonderful soundbite. I'm going to extract it and put it on replay for my daughters. I know one of them in particular that needs to hear this every morning after prayer. So I bet a number of
Yes.
other people can connect with that. So thank you.
So
And
it's simple.
well, I guess easy does it too. A thought that crossed my mind when we were talking about rest, when we're talking about, well, mind care and just being resting even while awake, a thought that crossed my mind is silence is golden. It's not just a
Yes.
pretty statement, but even just being able to sit in silence is something that we should teach ourselves to do and just
Amen.
allow the mind to empty out. Thank you. Thank you so much to my wonderful doctors. Thank you, because you have just shared a lot that that is very, impactful for us to take and run with. Two questions. One, I'm going to reserve for you, Dr. Carlos, because you're a man, so I would hold that for you. Dr. Bumi, we started off by saying we defined health and we said it's the soundness of mind, body, and spirit. So in a world where we are very prone to vanity and appearance and all of that, how exactly would being in sound health, what would that look like beyond appearance? For male and female, is it different, or do we converge at the same spot?
In this day and age, what people consider to be optimal health differs. But I would say that irrespective of the gender, the basics still apply to everybody, and that's what should be practiced really. Dr. Carlos has said a lot already, and I think that's where we start from really. We have this acronym we use a lot. That's a new start. Okay, and by the time we use all of those things, nutrition, exercise, water, sunlight, temperance, air, rest, trust in God, we get to have all of this come to play in our lives, and we get to have optimal health. If we can put all of this together, we get to have optimal health. But your question really was, how does it look like? Some of us think it is being very slim or looking athletic or achieving a particular, weight, dream weight and things like that. But that's not really it. We talk about health as being a complete well-being in body, physical, emotional, mental, and all of these aspects of life. And so I would say that having good physical function, okay, being active, exercising, having very healthy relationships, surrounding ourselves with good people, people that,
Yes.
yes, and friends, family, and all, and remove bad energy from us, okay? And being emotionally well. We talked about, temperance, talk about, yoga, meditation, praying. We've gotten to see that spirituality plays a long role in the well-being of people, and it's very important for us to pray and to meditate, and all of this just extends to gives us better emotional well-being and mental health. And so being emotionally well, sleeping well, resting well generally, because rest is not only sleep, but being able to relax and wind down, all of this gets to be very, very helpful. It's also very good for us to have meaningful activities, not just scrolling on our phones or engaging in idle activities, but when they're meaningful and productive, all of this gets to play on our psychology and helps us to feel better as people. Resilience is very important as well. Body being able to recover quickly, the body mentally also being able to recover quickly, they all come together really, because when we have good people around us, we get to have strength, support, and care that helps us to build ourselves back and recover from things easily. So we need to put all of these things together to be able to say that we have optimal health. Okay, it's not necessarily just the absence of illness, but it's a combination of things. And very importantly, going to health itself or preventive health itself. We've talked about food. We've talked about many things we need to do to be well and to keep ourselves in optimal health. So while we do the preventatives, eat the right meals, exercise, and engage in meaningful activities and things like that. We also make sure that we are praying, meditating, and surrounding ourselves with, people who are healthy, or I would say, good people with good vibes that can help us emotionally and mentally okay. So when we have all this together, I think we can say, by God's grace, we help somebody else.
Thank you.
Yeah.
I would come to give every doctor a quick 30 seconds to, do your final thoughts. But the question I reserved for you, Dr. Carlos, speaking on behalf of men, so you could put some extra thought into this. We found out that men are most likely to skip on going to the doctor, or they'll miss out, or they are most reluctant to talk with medical providers or to see them. So how can we help the men in our lives go to the doctors? How can we help the men in our community to be more intentional with their medical appointments and care?
Yeah. I think just this is the answer. Keep putting it in front of them, us. Keep putting it in front of us through these kind of community action forums, and then just encouraging it within your families. And that's really all you can do, because we still have to do it. So I would caution you, as women, as mothers and sisters and daughters, to not make it your responsibility to make men do the right thing for their own health and for their own good outcomes. You can just encourage them. You can just encourage us, and we still have to do it. So I think this is one of those things where women take far too much responsibility for something that they're not responsible for. And you're not responsible for me being responsible for myself. So I think gently encouraging it within your families and doing these kinds of community forums where we just keep putting it in front of men. That's all you can do. And that's all you need to do.
Thank you. You make it sound very easy because you could put it in front of them. You could put a sticker on the fridge. You could put
Yep.
everything, and the horse still wouldn't drink water. So,
Yeah.
okay.
Yep.
Well,
I would add to that, do not make them feel guilt. Don't use guilt to make them go to the doctor.
oh, Miss Simone, you had to bring that up.
Yes, don't use guilt, because sometimes we say, "Oh, you want me to be without a husband soon because if you don't go to the doctor, you make him feel guilty." So just use love, feed them
Yep.
well, and gradually, take them. Because remember, men are grown children.
Yes, we are.
Okay? Yeah.
It's so sad, but
They
we
are grown
are.
children. The children in a grown man, a grown person body. So that's why sometimes we take the lead as a mother in men's life, because they don't know what's good for them anyway.
Mhm.
We do. Sorry.
Sorry, not sorry. Thank you very much, Dr. Carlos, Dr. Simone, and Dr. Bumi. Very quickly, because we are at time. Usually we end this at 4:30. I crave everybody's indulgence for about 5 more minutes to just wrap it all up and finish out here. So if we could part with something, if you could give us something to part with today, in as few words as possible, closing statement, what would it be?
For me,
Okay, you could
oh,
start, Dr. Carlos.
okay. So for me, I have an Instagram tagline. I sometimes do health posts on my Instagram, and I end these posts with saying, it's not about living a long time. It's all of these things that we do to be healthy. It's really about living well for as long as we live. The idea is to not be sick with whatever amount of time we have on this earth. So living, it's not about how we look. After we optimize everything, you're going to look however you're going to genetically look. Okay, but so it's not about how we look, but it's about being healthy and living as well as we can for as long as we live.
Correct.
Thank you. Nicely said. Dr. Bumi, yeah, you're next.
Okay, I would say that I would advise us to really go back to the new stats. Okay, just type it in your Google if you're not sure, or I put it in the chats later on. Nutrition, exercise, water, okay, sunlight, temperance, air, what am I missing? Trust in God.
Rest.
Okay.
Rest.
Rest, thank you. Rest, and then trust in God. By the time we do all this, we just realize that somehow we get to live healthier lives, generally.
Thank you, Dr. B. And Dr. Simone.
I would say our body is the temple of the Holy Spirit, and it is our duty to keep it in shape. Like I like to say, it is a loan from God. The body doesn't belong to us, it belongs to God. So if you borrow my car, you need to take care of it, just like God gave us that body we borrowed the body so we can take care of it. Just like Dr. Bumi just said, the New Start program is the basis of a well-lived life, healthy life.
Thank you. Thank you to everybody who has, commented or even asked a question. Thank you so much to my auntie, Auntie Debbie. Thank you for always being here to just, keep the chat box going, and Dr. Finn for your always, chiming in and reacting. Thank you so much, everybody. I can't go over every name on the screen, you know that, but I am very, very thankful that we are all here. And like I said at the beginning, we keep coming month after month. It's just a very good feedback system that what we're doing here is good. And it would be lovely to receive feedback, actual feedback on what we're doing here, the topics, if there are topics you would like us to discuss, if there are things that we should tweak with our layout, that's by providing feedback. That's only how we can serve better. We can make sure our time is well spent here. And lastly, I am going to wrap us out with information about next month's discussion event. And you should see my screen shortly. Yes, you can. So next month's discussion event is going to be on June 28th. And again, it's going to be at 3 p.m. And the topic for next month is keeping tabs on Alzheimer's. So Alzheimer's? Yeah, Alzheimer's. Pardon me. So let's register. If you're new here, this is your first time being here, you were invited by a friend. Thank you for being here. And the link for that is bit.ly/EmbraceDGDE, and that will be in the chat box. Also, the link for feedback, we have it right here, and that is bit.ly/EDG feedback. So that's Embrace DG feedback. So bit.ly /Embrace EDG feedback. And every month we say this, we give back to our community, and we invite you to please partner with us on this. We have this annual back to school program that we do, and we've had recipients over the years who have been very appreciative of this. So this year we are giving to the refugee families of Decatur, and we are also giving to the Foster Care Support Foundation. So anything you can give goes a long way in ensuring that we can cater to more families and more students. So thank you in advance. And if you wish to also support our monthly discussion events, there is quite an investment that goes into hosting these programs. We thank you in advance for the ways you are looking forward to supporting us. And the ways to give, it's www.embracedg/ donate. And if you are curious about what the DG in the name stands for, it means it represents doing good. So embrace doing good. And by working together, we are collectively doing good. And the ways to connect with us, you can send an email, and that's going to be DG, that's doing good, at embracedg.org. You can visit our website for links to watch the past events and to also listen to the past events on the podcast. So that's www.embracedg.org. And you can find us on social media at embrace.dg. And lastly, just putting it out there for anybody who needs the information for how to register, please sign up for upcoming events using the link displayed on the screen. That is bit.ly/embracedgde. Thank you so very, very much. And with that, it's a wrap. God bless everybody. I pray you enjoy wellness. Just as the Bible verse says, I pray you are in good health. So that's our wish for you, and I hope you grab it with both hands. To my doctors, thank you. To everybody, thank you so much. God bless you. Have a happy new month starting tomorrow.